Hello and welcome to AMR Unplugged, a platform built to raise awareness on antimicrobial resistance. Today I'm joined by a very special guest. Her name is Dr. Chikwanda Chileshe. She is the co-chair of the Antimicrobial Resistance Coordinating Committee here in Zambia. She's not just a woman in science, a woman in AMR, but she's also a woman in animal health. Dr. Chikwanda, welcome.
Thank you, Msonda. Just a quick correction.
Yes.
Co-chair Research and Development
Yes.
at the MRCC.
Of course.
Yeah.
Thank you for the correction.
But we receive it.
Yes.
One day.
One day. Yeah, so really Doc is here to help us unpack the conversation that we are here to have, which is I think I've already alluded to the fact that we'll be talking about AMR in animal health. But before I start, I have some sort of like an icebreaker question, and it goes like this. So let's say AMR was a movie. What genre would you think it would fall under, according to your own opinion? Do you think it would be a thriller, a horror, drama, sci-fi? Maybe it could even be romantic. I don't know.
Definitely a horror.
Horror. How
Because,
so?
with AMR, it's not something that's palatable like malaria. It's not like you can say, oh, I'm suffering from malaria and you see the signs. AMR is the silent killer. You don't know you have it, but you have it. So it just creeps in. You go to the hospital. You're not healing. You're now there for the whole month. Next thing you know, dead. So definitely a horror.
Okay, you said something that has already sparked me. I tend to get sparked in my I get intrigued quite easily. But you said you have it, but you don't know you have it. So if there's someone who's listening for the first time about antimicrobial resistance, AMR, how would you explain AMR? Especially speaking to the very fact that you said you have it, but you don't know you have it. Is it a disease? Is it a condition? What is AMR?
So antimicrobial, okay, first of all, AMR is antimicrobial resistance, just in case there's someone out there wondering what AMR is. AMR stands for antimicrobial resistance. In a nutshell, or in simple terms, it's the inability of microorganisms like your bacteria, your fungi, your viruses, to respond to antimicrobials that they were once effective to. And I think this is a common conversation, especially these days. You hear people saying, I've been taking amoxicillin for 1 month now. I've taken it. I've done 2 courses. Back in the day, just within a week, I would be healed. But I don't know, is the quality of drugs these days reducing? Yeah. But little do they know that they could have developed resistance to the amoxicillin.
Right. And I know today we're focusing on animal health, AMR in animals, but because our audience are humans,
Yes.
could you give an example of a case of where the medication has stopped working based off the explanation, just so that people can also appreciate the conversation even from the perspective of the animals?
Okay, I think the story is the same in animals as well. Maybe even more so in animals, especially your chickens, because chickens are given antimicrobials from the time they enter the what do you call it, the poultry house, up to 6 weeks. So especially these days, the conversation is the same. I've been giving this to my chickens. I tried this. They're not working. They're just dying. What's going on? Chances are your chickens have developed resistance to a certain number of antimicrobials and it's just not working anymore. Yeah.
Yeah. So what would you say are the things that cause this resistance in animals specifically? Like in the case of the chickens, what are the drivers of antimicrobial resistance?
The main driver of antimicrobial resistance is I would say, is the inappropriate use. Quick question. Inappropriate use versus misuse. Are they the same?
I think they could depend. I mean, the connotation I think is the same.
Yeah.
But maybe depending on how you use the word, I'm not sure.
Okay, so inappropriate use or misuse of antimicrobials. This could be overdosing, underdosing, or even not finishing the dose. This is the main driver of antimicrobial resistance in animal health in general, not just for poultry. I think most farmers tend to say they want to stretch the pack of antimicrobials that they have. So they'll say, you know what, maybe if I just, instead of 10 milligrams in 20 liters of water, let me just put a 2 so that I can stretch it for so many days. Or maybe they'll say, I want the chickens to heal faster. So let me, instead of the 10 milligrams in 20 liters, let me put a 20. All that is falls under misuse or inappropriate use of antimicrobials. Yeah.
So in the conversation, I thank you so much also by basically for highlighting some of the drivers. So I'm trying to think about it from the perspective of someone who is listening, and we're trying to make a case for AMR in animals. Why should us as humans or farmers, why should they care about antimicrobial resistance?
I like to say what happens on the farm doesn't stay on the farm. Okay, chickens are kept almost by everyone, so I'll keep referencing to chickens.
Yeah.
So let's look at it like this, right? Our chickens, because we've been administering antimicrobials, have now developed resistance. Chicken manure, most of us use it in our gardens, right? So we take that manure, take it to our gardens. Those antimicrobial resistant genes are able to move through the plants, and when we ingest those plants, we are able to get the AMR genes. Also, there's now this notion where people are feeding chicken manure to their fish. So once again, the fish are getting resistance just from the chickens, and once that's done, all this food ends up in the food chain, and eventually ends up to the humans. So it's a cycle. It's a chain. So in as much as humans may think, "Ooh, animal health, I don't keep chickens. How does this affect me?" The truth is, these antimicrobial resistant pathogens or genes do find themselves in the food chain and eventually to humans.
Yeah, I think that's I like how you connected how it affects humans and how we really should care about it. I'm wondering though, from some of the conversations that I've been part of in terms of like the workshop that we had where we were developing the training manual for farmers, and so on and so forth. So also wanted you to explain more on when you're talking about the impact to the humans as well. What about things like the economy on a larger scale? What are the other impacts, to human health as a result of AMR in the animals?
Okay. So let's look at it from a human perspective. Once you get antimicrobial resistance, you find that you do not heal from illnesses as quickly as you used to. So that prolonged illness leads to a prolonged hospital stay. And prolonged hospital stay leads to loss in income, because chances are at your workplace, some people may not pay you for the number of days you are absent. Also, the long hospital stay now means that you are paying more for your hospital bill. And eventually, if you do not heal, you end up dead. So there's loss of income from both the employer and the employee, which I guess eventually affects the economy. Yeah.
Thank you so much. What about things like food safety, the trade in itself? To what extent do you think AMR has an impact on that?
I think it has a very big impact, because when you look at food safety, we then begin to talk about things like residues. And I think this is something maybe most people may not be aware of. Once again, I'll go back to the chickens. If you do not follow your withdrawal period, there's people that will give antibiotics up to the 5th week or the 60th week. It means those residues remain in the chickens, and the human beings then consume those chickens. Therefore, we are transferring these resistant pathogens to the humans. Same thing with milk. If you are giving antibiotics to your dairy cows and not adhering to the withdrawal period, that milk ends up in the food chain, especially in the informal sector. For if you're selling it to places like Parmalat, they do test. But now, in village settings, it's just any other day. It's just milk. They don't see the problem with that. So that then ends up in the food chain, and humans consume that milk with the antimicrobial residues. Yeah.
Yeah, no, I think that's a well-rounded response, which I must thank you for. So now my mind is reeling. I'm thinking, okay, so there's a problem.
Mm-hmm.
It has drivers.
Mm-hmm.
It even has consequences.
Yeah.
So how can we change the narrative? I would like you to speak specifically to the farmer, or let's just say, I like how you say that people who may not be called farmers still keep chickens.
Yeah.
Yeah. So maybe let's just say to people in general.
Mm-hmm.
if we were to say, behaviors need to change, or, I don't know what the solution would be, how how does behavior change look like in this conversation? And when we're talking about, you talked about misuse and improper use of this medication. That means stewardship, better
Mm-hmm.
stewardship of this
Mm-hmm.
of these precious medicines.
Yeah.
What does AMS look like in the animal health sector? So I don't know if you can tie those together
Okay.
in your response.
So I think you've asked two questions.
Mm,
Your first one was pertaining to behavior change.
right.
I think with behavior change, it's up to people like you and I to continue raising awareness. Really, that's the best we can do, raise awareness. And it's up to our audience to then adhere to what we're saying and change their behaviors. Just don't share medicine. Get a prescription before you get your medicine. Visit your doctors. It's just it's in these simple things that we preach about, and hopefully people can adhere to it. But I think people would adhere better if they knew the consequences, not just us explaining what AMR is. I think maybe it's time we put numbers to this AMR problem so that they can see how serious it is. So for me, it's up to us as human beings to just change our behavior. Then when it comes to AMS in the animal health sector, it can simply be defined as coordinated efforts to promote the prudent use of antibiotics, drug optimization, in short. Yeah.
Okay. No, thank you so much. And so I have one last overarching area that I wanted you to
Okay.
to connect. So in the beginning, you really connected the how resistance affects humans. So you made the connection between the animals and the human. And so the big concept right now, in terms of when people are addressing antimicrobial resistance, is one health, one health.
Mm-hmm.
So how do you think the umbrella of one health, can help us tackle the problem of antimicrobial resistance? Because we've done human and animal to human, but
Mm-hmm.
then there's something else missing in the cycle.
Yeah.
Yeah.
I think what the One Health approach is the only way we're going to solve this problem. Um, if we look at the environment, everything we do ends up in the environment, whether it's disposing drugs, disposing our manure, um, even, for example, the fish. The only way of giving antibiotics to fish is through the water.
Right.
And that water isn't stagnant, it,
Mm.
it keeps moving through the environment. So the environment also is a key player in the One Health approach, and we cannot leave it behind. So in as much as we know that the efforts to reduce or combat antimicrobial resistance started with the human health, it's very important that the other two sectors come on board and we all move together. That's the only way we are going to curb antimicrobial resistance.
No, thank you so much for that. So, as someone who has closely been working with this problem of antimicrobial resistance, what really gives you the hope, as we address? I almost said fight antimicrobial resistance,
Mm-hmm.
but there's a whole discourse about how we shouldn't say we fight, because not all microbes
Yeah.
are, bad microbes. But yeah, as you address antimicrobial resistance, what gives you the hope, to keep pushing? Because it seems like you said, all we can do really is to keep raising awareness. But sometimes the efforts feel like, they're
Futile.
exactly. So what gives you the hope to continue in this work of antimicrobial resistance, addressing antimicrobial resistance?
Okay. Like I had earlier alluded, the fight against antimicrobial resistance started mostly with the colleagues on the human health side. But in the last 5 years, I think the work we've done in the animal health sector regarding antimicrobial resistance has been so brilliant. It's been great. We've seen the animal health sector rise to the, don't want to say the fight now, rise to the occasion.
Yeah.
And when you are dealing with things like antimicrobial resistance, we need guidelines. And I think that's something we didn't have in the animal health sector. And in the past 5 years, to look at the guidelines that we've come up with, it's just been amazing. If we look at the current situation now, we are drafting our treatment guidelines, which are a very essential component of antimicrobial stewardship when fighting animal health. So it's these little wins that make, I guess, me and the rest of the team continue to push, because you're seeing this coming from maybe 5%, now at 50. And when you go for these conferences and they tell you, what, Zambia is doing really great. And everyone is saying, be like Zambia. And you're like, that's a win for us. And it gives you motivation to keep pushing. Yeah.
You touched a little bit on something that I almost neglected, actually. You're coming from the Antimicrobial Resistance Coordinating Committee. I mean, that's the governing body in Zambia on anything to do with antimicrobial resistance. And so it would be a loss for me to let you go without talking about, you talked about guidelines, so it sparked my mind to say I didn't talk about anything about policy, the actions that are currently in place, at that level, at that high level, in addressing antimicrobial resistance in animal health. Yeah.
So the MRCC is the coordinating committee, as you've said. So there's levels to addressing AMR, I guess. We start at national level, there's a sub-national level, all the way to the community and to the farmers. I think at the top part, it's to ensure that we have guidelines, like I said, because there's certain work that you cannot do if you do not have a guideline. So I think the Antimicrobial Resistance Committee has been doing a very good job at national level to ensure that we have the guidelines that we need. We are carrying out stewardship programs in various hospitals, and now we have guidelines for stewardship, which we didn't have in animal health. Now we are creating these, and all these are happening at national level at the MRCC level. So I think it's work is going, and it's watch this space.
We definitely will be watching this space. Yeah. So what's the one message after the whole conversation we've had? What's the one key message that you would like to leave our listeners with, even as we conclude our discussion? If you could sum everything up in your own words, what would you say?
I think, like I had earlier said, we need to start putting numbers to this thing. So the numbers I'm about to say are not like Zambian numbers, but worldwide figures, just so that people get a perspective of how serious the AMR problem is. Which camera am I facing?
I like that.
4.9 million people die every year due to antimicrobial associated deaths. And of these 4.2 million, 1.2 are directly linked to antimicrobial resistance. So people are dying. And most of these deaths are happening where? In sub-Sahara region. Where is Zambia? Sub-Sahara region. Also, 10 million deaths will occur per year by 2050 if we do not do anything about antimicrobial resistance. So that's the message you must take back home. It's not propaganda. It's a problem. It's real. And we have to address it.
You know what? I feel like that is even sufficient as a closing, as a closing for today's show. Thank you so much, firstly, for being on the show today. Thank you so much for the insight and the knowledge that you've been able to share. And thank you for the closing, because I feel like you made my work easier, because I'm just going to say thank you so much for listening. Yeah, thank you so much. I really appreciate it.
Thank you, Msonda.
Yes. So thank you as well to you for watching and listening in. This has been AMR Unplugged, a podcast that has been brought to you by React Africa. I've been your host, and I am still your host, Msonda Lamba Milapo. Thank you.